Standard Theory for Dentures. I am Sotokawa, a dentist practicing in Morioka City, Japan. This topic covers the emergency treatment for dentures. Contents. Introduction. 1. Repairing broken dentures. 2. Tissue conditioning. 3. Rebusing. 4. Building artificial tooth occlusal surfaces. 5. Adjusting clasps. 6. Adding teeth on the day of extraction. 7. Adding or replacing clasps. 8. Adding clasps and artificial teeth. 9. Adding denture bases. Introduction. Dentures are used in harsh conditions, so damage to them occurs routinely. Since denture damage significantly impairs patients' dietary habits and health, prompt repair is necessary to restore chewing function and maintain patients' healthy daily lives. On the other hand, denture fabrication typically begins after waiting for the alveolar ridge to heal following tooth extraction. However, patients waiting for ridge healing are forced to endure aesthetic issues or dietary inconveniences due to ill-fitting dentures. These patient inconveniences can be resolved by same-day denture repairs. As a result, patients can maintain a comfortable diet and overall health even during dental treatment. 1. Repair of a broken denture. Step 1. As shown in the upper right photo, if a denture fractures, use instant adhesive to bond the fractured denture back to its original state. Pour plaster onto the mucosal surface of the bonded denture to create the model shown in the lower right photo. As indicated by the arrow in the lower right photo, if a crack has formed in the portion of the denture that contacts the abutment tooth, plaster must be built up to cover the cracked area on the abutment tooth side. This plaster portion may break when removing the denture from the model. Therefore, when removing the fractured denture from the model, careful handling is required. 1. Repair of a broken denture. Step 2. After removing the fractured denture from the model, apply a release agent to the model surface. As shown in the upper right photo, remove the fractured portion of the denture at an angle to create space for building up the instant polymerization resin. Next, reattach the fractured denture to the model. As shown in the lower right photo, build up the instant polymerization resin on the area where the denture base was removed, then polish the surface after polymerization. 2. Tissue conditioning. The alveolar ridge undergoes significant morphological changes during the first 1 to 2 weeks after tooth extraction as it heals. During this period, dentures become unstable, causing difficulties for patients in their eating habits. Tissue conditioning can stabilize dentures even when such significant changes in alveolar ridge morphology occur. As a result, chewing function is not impaired, and patients can maintain their health. While waiting for the soft relining material to harden, position the patient standing with a slight forward lean and have them bite lightly. This prevents the relining material from flowing into the patient's pharynx. 3. Rebase. Step 1. When patients complain of denture instability, immediate composite resin lining material can be used to temporarily restore chewing function. The upper right photo shows a denture with an extension repair indicated by the arrow after extraction of upper left tooth 5. To maintain the patient's chewing function for 1 to 2 months until the alveolar ridge stabilizes and a new denture can be fabricated, a relining is performed using immediate set resin. The lower right photo shows the impression being taken using the immediate set resin relining material. 3. Rebase. Step 2. The photo on the top right shows the denture after the immediate polymerization resin lining was completed. The photo on the bottom right shows the denture being fitted into the mouth after rebasing. 4. Artificial tooth occlusal surface buildup. Step 1. As shown in the photo on the right, the occlusal surface of the denture artificial tooth may become worn and lose contact with the opposing tooth. In such cases, chewing function can be restored by directly building up the non-occluding artificial tooth surface with immediate composite resin. 4. Artificial tooth occlusal surface buildup. Step 2. The upper right photo shows the denture's occlusal surface with crown-colored instant polymerization resin built up, in the process of being occlused before the resin hardens. The lower right photo shows the instant polymerization resin hardened, with the opposing tooth's impression mark on the denture artificial tooth. 4. Artificial tooth occlusal surface buildup. Step 3. The photo on the top right shows the denture base after trimming the built-up resin portion and polishing it. The photo on the bottom right shows the denture with the artificial teeth built up and fitted. 5. Adjusting the clasp. As indicated by the arrow in the upper right photo, partial dentures may become prone to dislodgement due to deformation of the retention arms. In such cases, as shown in the lower right photo, the deformed retention arms can be easily adjusted using pliers or similar tools. If the clasp arms are deformed, adjustment becomes difficult. Therefore, clasp arms must be designed robustly to prevent deformation. With wire clasps, both the retention and retention arms are made of wire, making adjustment of the clasp quite difficult. If adjustment of a wire clasp fails, the abutment tooth may experience persistent lateral pressure, potentially damaging its periodontal tissues. 6. Tooth extraction on the same day. Step 1. In some cases, remaining teeth may be extracted to transition to a complete denture. In such cases, before extraction, an extension repair is performed on the old denture at the site of the planned extraction. The repaired denture is then fitted simultaneously with the extraction. This extension repair performed concurrently with extraction promotes hemostasis after extraction and further prevents a decline in the patient's chewing ability. The procedure is explained below. The photo on the upper right shows a case where the upper left third and fourth teeth were extracted to transition to a complete denture. The photo on the lower right shows the partial denture for that area. 6. Tooth extraction on the same day. Step 2. First, as shown in the photo on the right, use a cutting disc to remove the clasps from the old denture. Next, place the old denture with the clasps removed into the mouth and take an impression with the denture in place. 6. Tooth extraction on the same day. Step 3. The upper right photo shows the model with the old denture in place. This model is mounted on the articulator along with the opposing teeth. When the number of teeth to be added is small, it may be possible to repair the denture without mounting it on the articulator to reduce treatment time. As shown in the lower right photo, the remaining teeth scheduled for extraction are removed from the model. 6. Tooth extraction on the same day. Step 4. As shown in the upper right photo, artificial teeth are arranged on the remaining tooth structure and temporarily fixed with utility wax. During this process, the occlusal relationship with the opposing teeth is checked. The lower right photo shows the base portion after immediate polymerization resin has been built up. 6. Tooth extraction on the same day. Step 5. The photo on the upper right shows the denture after the tooth replacement repair was completed. The photo on the lower right shows the denture with the tooth replacement repair being fitted immediately after the remaining tooth was extracted. Fitting the tooth replacement repair on the day of extraction promotes hemostasis after extraction and prevents a decrease in the patient's chewing efficiency during the healing period of the extraction site. 7. Adding or replacing clasps. Step 1. Damage to clasps compromises the stability of partial dentures and reduces the patient's chewing function. In such cases, as an emergency measure for the denture, additional clasps are added to allow temporary use of the denture. The photo on the right shows a case where the buccal clasps on both sides have fractured. 7. Adding or replacing clasps. Step 2. As shown in the upper right photo, use a cutting disc to remove the damaged clasp. When doing so, ensure sufficient space is maintained between the baseplate and the abutment tooth to allow for the placement of a new clasp on the abutment tooth. Therefore, remove the portion of the baseplate adjacent to the abutment tooth. The photo on the bottom right shows the impression model taken with the denture after the clasp was removed, seated in the mouth. At this point, as indicated by the arrow, it is confirmed that space exists between the denture and the abutment tooth for placing the clasp. 7. Adding or replacing clasps. Step 3. The photo on the upper right shows bending a wire clasp 0.8 mm to fit the hook tooth, then temporarily securing the bent wire clasp to the hook tooth using utility wax or similar material. At this stage, ensure the new clasp does not contact the opposing tooth. The photo on the bottom right shows the bent wire clasp fixed to the baseplate using instant set resin. At this stage, the clasp's retention arms are not installed. Instead, to provide retention, the lingual surface of the remaining teeth is covered with instant set resin. Any hardened resin that enters the undercut area of the lingual cervical region of the remaining teeth must be removed by cutting. 7. Adding or replacing clasps. Step 4. The photo on the top right shows the denture after repair with a clasp added. The photo on the bottom right shows the repaired denture fitted in the mouth. 8. Additional artificial teeth and clasps. Step 1. The patient complained of instability with their maxillary denture. As shown in the photos above and below, the clasp on the upper left 4 was deformed, and the upper right 3 had been extracted and left untreated. 8. Additional artificial teeth and clasps. Step 2. As shown in the upper right photograph, the upper right clasp was removed using a cutting disc, and the lingual arm of the upper left clasp was removed. As shown in the lower right photograph, an impression was taken with the denture fitted after removing the clasps. 8. Additional artificial teeth and clasps. Step 3. The photo on the upper right shows the model with the denture to be repaired in place. The clasp on upper left tooth number 4 does not fit the anchor tooth. However, since the tip of the labial arm is contacting the anchor tooth, we determined that adding a base to the lingual side of the anchor tooth would provide retention. The photo on the bottom right shows the left upper 3 artificial tooth and the left upper 4 wire clasp 0.8 mm fixed with immediate setting resin. 8. Additional artificial teeth and clasps. Step 4. The photo on the upper right shows the repaired denture with an artificial tooth added to the upper right third molar and a clasp added to the upper right fourth molar. The photo on the lower right shows the repaired denture fitted in the mouth. 9. Additional denture bases. Step 1. As shown in the upper right photograph, the patient is using a denture for the missing teeth in the lower right 5 to 7. As shown in the right lower panoramic X-ray, the alveolar bone has been resorbed down to the apex of the left lower 7. Therefore, it is necessary to cut the mesial portion of the pontic on the left lower bridge and extract the left lower 7, which is the abutment tooth. For this extraction, we established a treatment plan to place a clasp on the left lower 5, add a base to the left lower 6 and 7 area, and fit the repaired denture simultaneously with the extraction. 9. Additional denture bases. Step 2. Take impressions of the upper and lower jaws with the dentures in place. Mount the upper and lower jaw models on the articulator, as shown in the photo on the right. Cut the pontic at the mesial aspect of the lower left sixth tooth on the model. Next, remove the model sections for the lower left sixth and seventh teeth. Apply a separating agent to the surface of the model. Place the denture to be repaired onto the model with the separating agent applied, as shown in the photo on the right. 9. Additional denture bases. Step 3. As shown in the upper right photo, bend the wire clasp of the retention arm to fit the new anchor tooth, lower left 5. Secure the bent wire clasp to lower left 5 using instant cure resin. As shown in the lower right photo, build up the base portion on the model using instant cure resin. For the artificial tooth portion, build up the crown-colored instant setting resin on top of the base. Before the resin hardens, bite it against the opposing tooth to create an impression of the opposing tooth on the resin surface. 9. Additional denture bases. Step 4. After the instant polymerization resin has cured, remove the denture from the model. Trim away any sharp edges on the denture and polish its surface. The photo on the upper right shows the denture after the tooth addition repair was completed. The photo on the lower right shows the denture being fitted immediately after extraction of the lower left 7. Standard theory for dentures. Emergency treatment for dentures is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comment section below.